Welcome, everyone. I'm Lisa Esquivel-Long, editor of KPC Media's Greater Fort Wayne Business Weekly, and I'll be your moderator for today's webinar. This is the 6th in a new monthly series that we're bringing free to subscribers. The topic of today's webinar is COVID-19 and vaccinations, what every employer needs to know, with a presentation by Barrett McNagny. I feel like we got the gang back together again, Joe, because you sponsored one of our previous webinars, so things are ever changing. So everyone, we want to hear what you're concerned about. So during today's webinar, please ask your questions by going to the Q&A. Going to the Q&A section that you'll find on the right-hand side of your screen. So not the chat, but the Q&A section. We'll go over your questions periodically throughout the presentation. So here with us today are H. Joseph Cohen and Rachel K. Steinhofer of Barrett McNagny. Welcome to Joe. We're going to start off with you. So welcome, Joe. Please tell us a little bit about your background and start us off on this important topic, which I know is ever changing. So.
Thank you. Thank you, Lisa. Yes, my name is Joe Cohen. I'm a partner with Barrett McNagny. Been with Barrett since 1996, practicing exclusively in labor and employment law and healthcare law. As you'll hear from later today, my partner Rachel Steinhofer will also be speaking, who also practices exclusively in labor and employment law. This has been certainly a topic when it comes to COVID-19 that we've been dealing with probably for at least 18 months now. We try to keep everybody updated as much as possible, as this has been very much, as we say, ever changing. So we'll talk primarily or almost exclusively today in regards to the ETS, what we call the ETS, the Emergency Temporary Standard that was passed on November 5th, 2021. So let me get to the first slide here. There we go. And all righty. So on Friday, November 5th, 2021, OSHA passed what we call the Vaccination, Masking, and Testing Emergency Temporary Standard, which was published and made effective at that time. So the first question, I think, we'll get to all the specifics in regards to who it covers and whatnot, but this was passed based upon the administration, President Biden's administration request for a vaccine mandate to employers that covers those employers that have 100 or more employees. And so that's what this guidance, if you will, that was passed or published on November 5th provides, is supposed to provide or fill in the blanks from that executive order. So the ETS covers those employers with 100 or more employees. Now, importantly, this calculation is not is the entity's total number of employees, okay? It's not based on the number of employees at a single location. So if you have, technically, if you have 10 locations and each location has 10 employees, you're gonna be covered because that's 100 employees. So it's not each location, it's all locations combined. It goes on to say employees of separate entities are counted separate from other related entities unless they share safety guidance and governance among 2 or more entities. So what does that mean? If you have a widget company that has the controlling, governs all the administrative aspects of 4 or 5 different entities down below, if you will, in their corporate structure, it's possible that all those lower entities that are governed by the widget company would all, if you combine them all, would hit 100, only if they share safety guidance and governance among all the entities. It's a pretty gray area. We've been asked that, what does that exactly mean? Sharing safety guidance and governance, does that include HR functions? My guess would be yes, that it would include HR functions. So if all your HR functions are governed by in one central area that covers 2 or 3 different entities, those 2 or 3 different entities are going to be combined combined together to count that 100 or so employees and then be covered by the ETS. One thing to keep in mind, as we'll talk about here in a second, is that there's a difference between the total number of employees, that 100 number, versus the total number of employees that would be covered. In other words, you could have 103 employees, only 4 of them ever report to work. okay, because everybody else, all 99 of them work remotely, still would be covered because total number of employees is still 103. So there's a lot of different, ramifications of that. But at the end of the day, it's your total number of employees, not the total number of employees that may be governed by the ETS. And why is that important? Is because there are some employees that are going to be exempt from the ETS because they're not deemed to be in grave danger. And we'll talk about that in the next slide. Another thing to keep in mind is when we talk about these 100 employees, you may be sitting there and say, well, I don't have to worry about this because I have 95 employees. And that's true. At this moment, you would not have to worry about that. But if you would hire 5 employees over the next couple of months and hit that 100 number, you would now be covered by the ETS and would have to be responsible for fulfilling all the obligations within the ETS moving forward. At the same time, if you had 105 employees today, and then you end up terminating 6 employees or 7 employees over the next 30 days, so you're now under the 100 threshold, you still would be covered by the ETS. So once you hit that 100, whether it's at the time on November 5th when it went into effect, or sometime in the future, once you're over 100, you're always over 100, even if you're fluctuating around that number or not. So it's something to definitely keep in mind. If you're around that 95 number or 105, if you will, it's not going to matter. Once you get past 100, you're always going to be covered by the ETS. So we get this question asked a lot. Why 100 employees? What's the difference from a health standpoint between having 50 employees or 100 employees or 150 employees? Well, the regulations or the guidance that were published by OSHA kind of goes through their rationale. And I just tell you this, not necessarily because we all agree with it all, but at least to kind of give you a little bit of background as to what the reasoning or what the rationale was. One is they figured that with 100 employees, it's going to be easier for those employers to have that large of a workforce to be able to meet and comply with the standards within the ETS. It was their rationale that if you had less than 100, you may not have the corporate or HR structure to fulfill the obligations within the ETS. 2, their theory was that if that 100 employee mark was a appropriate number to that, they'll reach approximately 2/3 of all private employers across the country. And that was covering obviously an overwhelming majority of all the employees at that point as well. So they thought that was another good number to land on. And third, there was in their minds, based on the research that they have done and the research that they have had been provided to OSHA, is that they felt that the larger the company, especially the ones over 100 or more, have the largest risk or the highest risk of whether it's death or severe injuries or severe sickness to their employees, because there are so many people that it can be passed around to, as opposed to a smaller employee. So that's kind of the rationale as to why they picked that 100. It wasn't just, I guess in their minds, wasn't just a random number that felt good. It was, at least in their minds, some science behind it. So then moving on then to the next bullet point. So these are the 2 important dates that we need to keep in mind, that by December 5th, 2021, covered employers, that's going to be those who have over 100 employees, must have a policy in place, disseminate that policy, as well as some additional information that Rachel's going to talk about later on this morning, to its employees, require proof of vaccination, okay, and require masking of individuals who cannot provide proof of vaccination. Okay, that all has to be done by December 5th, 2021, as we sit today. Rachel is going to talk a little bit later on this morning about some of the ramifications of some of the court decisions that have been happening in the last couple of weeks that could be pushing some of those dates back potentially. So then, effective January 4th, 2022, employees must be fully vaccinated, or in the alternative, provide testing results showing a negative test for COVID-19 on a weekly basis. So why a mandate? And as we'll learn here in a second, although everyone's referring to this as a mandate, it technically is not a mandate, because OSHA is not mandating every employer have a mandate for all their employees. And there's actually a choice, and we'll get to that in a second. But OSHA's rationale within their guidance is that they feel that a mandate is more effective in getting more people vaccinated than simply encouraging a vaccination. Obviously, the ultimate goal of this mandate is to get as many people vaccinated as possible so that we get herd immunity and get the percentages up so that COVID-19 will slowly start to dissipate and not affect as many individuals. Along those same lines, it was what's interesting, and I think this is certainly debatable, and it was debated within the guidance itself, is this mandate and the impact on employee turnover. They had received a lot of comment, they being OSHA, from employers saying, listen, if you do a mandate that requires all of our employees to be vaccinated, we're going to lose employees because employees are just going to quit. If I have 100, 115, 200 employees, those employees that don't want to be vaccinated are simply going to leave my employment and go work for someone who has 50 employees, or they're going to go start their own business. They're going to do something different, and I'm going to be stuck without any employees. And what's even worse is if I had 105 employees and 10 of those employees decide to go do their own thing, I'm still governed by the ETS, but now I only have 100 employees. And I lost those 10 employees because they didn't want to be mandated. And maybe I can't provide the services that I originally what we're providing. Well, in OSHA's logic, their position is that, yes, that's true. That's possible. That could be a cost of having this mandate. But they feel very confident in the fact that they think that there's going to be a big rush of employees or prospective employees who are going to apply for employment to those employers that are mandating the vaccine to their staff, so that it goes both ways. There will be some people who don't want to be vaccinated and may leave, but there are going to be just as many, if not more, folks who will be coming back to the workforce because they're going to work for those employers that have mandated the vaccine because of the obvious health benefits. So that remains to be seen, but that's some of the rationale that OSHA has presented within its guidance. This last point doesn't necessarily apply to Indiana as much, but it does go into significant detail in regards to state and local laws that have been passed in the last 12 months that have banned employer mandates for vaccinations, and essentially indicates that this ETS overrides or preempts, if you will, any state or local laws that ban vaccinations or ban employers having a vaccine mandate. So any employer in one of those jurisdictions can have a mandate based on the ETS and not have to worry about violating state or local law. All right, so what are the employer requirements within the ETS? So as I said just a moment ago, the employer must choose either to mandate vaccination of every employee or, in the alternative, require masking and testing for unvaccinated employees, and that this testing must take place on a weekly basis. That's really the nut of the whole, the whole ETS in a nutshell, is that the employer either has to have a vaccine mandate for all of its employees or have a policy in place for those who are unvaccinated to get weekly testing and wear masks at all times for the most part. As you know, with everything that the government does, there's always exceptions to every rule. The first exception is in regards to every employee must be mandated to be vaccinated. There are exceptions to the mandate. First, those employees that are medically contraindicated. In other words, there's a medical condition that's going to make it so that they can't have the vaccination. Two, if there is some medical necessity that the employee is currently experiencing that would require a delay in the vaccination. In other words, they have some illness, they have some disease, they're getting treatment for some condition that they can't have the vaccination at that moment. And as a result, they're going to be they're not going to be required to receive the vaccine mandate or require the vaccine. And the one that we probably hear about the most is a reasonable accommodation. So that would be those who have a disability that would cause them not to be able to receive the vaccination, or a sincerely held religious belief that would cause them to be unable to receive the vaccination. So if you have one employee that would fall into one of those three categories, even if the employer does have a vaccine mandate, those three, any employee that would fall into those three would be opting out, if you will, of the mandate that the employer would have put in place. As I said earlier, and this is where things get a little bit confusing, that I use that term grave danger. That's the term that OSHA used in order for them to have the authority to pass the ETS in the first place. and a grave, and however, even though they said that there was a grave danger to employees within the United States as a result of COVID-19, meaning that those employees that are in the workplace are in grave danger of receiving or obtaining COVID-19 if they have not been vaccinated. But with that being said, they also said, however, we also know of some employees that are not in grave danger. Okay, so there's exceptions to the exceptions, if you will. So these are the three exceptions to the grave danger thing. I'll tie it all together as to how it all works. But so there's this grave danger determination of all employees. However, there's three exceptions. One, those who don't report to the workplace. Okay, so the grave danger applies in the workplace. Well, if you're not reporting to the workplace, the employee or the OSHA has indicated that if you're working from home, if you will, remotely, you're not in grave danger because you're not in the workplace. You're working on your own outside the workplace. If you're performing all your work outdoors, from a scientific perspective, and the guidance indicates that the chances or the likelihood of contracting COVID-19 is much, much, much less outdoors. So if you are working exclusively outdoors, or all of your work is performed outdoors, you're not, quote unquote, in grave danger. The third one is you work alone in the workplace, that there is nobody else at work. You're by yourself. Again, then there's no way to be exposed to, or the likelihood of being exposed to COVID-19 becomes statistically very, very low. So those individuals are outside the scope of a grave danger determination. So that would mean that if the employer has a mandate of a vaccination mandate under the ETS, these three groups of employees would not necessarily need to be mandated to be vaccinated because they're not, quote unquote, in grave danger. Okay. Now we say that they don't necessarily need to be vaccinated because they're not in grave danger, but they're still counted in the number of employees to determine whether the employer meets that 100 employee threshold. Okay. Same thing with the exceptions to the mandate for those who are medically contraindicated. There's a medical necessity to delay the vaccine, or there's a reasonable accommodation. Those employees also fall within the 100 employee threshold, but they may not need to get the vaccination because of a exception from a medical standpoint, as opposed to the grave danger exception, if you will, or not being in grave danger. Other points in regards to that first bullet point. So that's, as the employer, you get to choose technically, do I want the vaccine mandate? Or I can say to the employees, okay, we're not going to do a vaccine mandate, but we're going to give you the choice, employee, to either be vaccinated, or if you don't want to be vaccinated, you can wear a mask and be tested every week. And that is allowable, even though OSHA went through and spent pages and pages and pages indicating the importance of a vaccine mandate. At the end of the day, they said, although we think the mandate is the best route, we are going to give the employer the choice that if they don't do a vaccine mandate, they have to have a policy in place that requires those individuals who are unvaccinated to wear a mask and to be tested weekly. Now, importantly, in that situation where you have given your employees the opportunity not to be vaccinated and instead get tested weekly, we get asked this question a lot, that the cost of testing itself is going to be borne by the employee. So if the employee decides, I don't want to be vaccinated, I'm going to go get tested every 7 days, that's fine, but that employee is going to be paying for the time for the actual test. That employee will be paying for the masks that they will be having to wear on a day-to-day basis at work. The thought being, from OSHA's perspective, is that there is at least a financial incentive for the employee to get vaccinated, in that they won't have to pay for the weekly testing and they would not have to pay for masking if they get vaccinated. Up until this point, or previously, it had always been the reverse, that most of the costs were always borne by the employer. So just again, something to indicate a little bit of the rationale behind the rules. So if you go on to the next bullet point, so if the employer does choose, or actually under either option, the employer must determine the vaccination status of each of its employees. Okay, so even if you decide, hey, we're going to do a vaccine mandate for all of our employees, you're going to have to do what I did, obtain information on the vaccination status of each of your employees. Or if you decide, okay, we're not going to mandate the vaccination, we're certainly going to encourage it, but for those who are not vaccinated, we're going to require them to get tested every week and to wear a mask. You still have to understand what the vaccination status is of all your employees, and the ETS requires that. So in order to do that, you are going to need to confirm the vaccination. You're going to need to get information from the employer that must require acceptable proof of the employee's vaccination status in order to confirm the vaccination. The employer must also maintain records verifying the vaccination status of its employees, along with a list or a roster of each employee's vaccination status under the ETS, and that information that you're gathering on the vaccination status are going to be considered medical records, and you're going to have to keep them confidential and only share those with those individuals who have a need to know. So this kind of break that apart a little bit. Okay. So, and we're going to get to each one here between myself and Rachel. So you're going to have to confirm the vaccination status of all your employees, which means that if I am vaccinated, I am going to have to show you documentation to demonstrate that I am vaccinated. And we're going to get here the next slide about what proof I must show you in order for it to be acceptable as to confirmation for vaccination status. Okay. If I am, and that will be kept in some portion of my personnel file, not my employment, not the employment aspect of my personnel file, but the medical record portion of my personnel file. The employer is also going to have to keep a roster in addition to my own personnel file, but they're going to keep a roster of all their employees. And that roster is going to have a listing of each employee's vaccination status. And that is going to demonstrate, one, whether each employee on this roster has been vaccinated fully, vaccinated partially, unvaccinated because of an accommodation, or four, that employee has not provided proof of vaccination, which under the ETS, if an employee does not provide proof of vaccination, they're deemed to be unvaccinated. So in addition to having to maintain the records of my vaccination, if you will, or my testing, if I've chosen not to be vaccinated, you're also going to have a separate list or a roster of all your employees that show that information. That's so that it's a quick reference. If OSHA wants to look at it itself, you'll be able to have a quick guide for OSHA as well if they should audit you, so on and so forth. Now, importantly, with these medical records and this roster that we've been referring to, although they're considered medical records and they have to be kept confidential, they need to be kept separate from the other employment records that you may have on all your other employees. They only have to be maintained for as long as the ETS is in effect. Okay. Now, if it becomes a permanent thing, they're going to have to update the regulations as to how long these records must be maintained. But once the ETS is, because it's a temporary standard, once the ETS is canceled, if you will, then those records would not necessarily have to be maintained any longer, these medical records that we've discussed.
Question. Joe?
Yeah.
We're getting lots of questions as this is such a big topic.
Yeah.
And let me know if these are some things that you and Rachel are going to go through.
Oh, absolutely.
But one, a lot of them, I'm getting them about the Q&A in the chat, so I'm kind of trying to assimilate them. So, so again, there's the question of the HIPAA violation. Isn't sharing vaccination status with an employer a HIPAA violation? And there's a lot of questions as to, does somebody need to be, I guess, HIPAA certified, like an HR, in order to be looking at these records?
No. So the short answer is no. These are not, I understand from a HIPAA standpoint, but this, although they're deemed medical records for the ETS in regards to maintaining them separate from everything else, they're no different than the documentation you'd receive for FMLA purposes, or for someone who wants a reasonable accommodation under the Americans with Disabilities Act. Although those were all medical records, if you will, and need to be kept separate. They're in the employment function of your role in the HR, as opposed to being a medical provider. All of us in HR are not medical providers. We are just receiving this information for the ETS. So it's not necessarily HIPAA protected, but they need to be kept in that situation. Okay. So now I'm not saying that you can go and tell anybody about it, because they're still maintained confidentiality. So if any of your employees say, well, I can't tell you because that violates my HIPAA rights, that's not accurate. They have an obligation under the ETS to provide that information to you. regards to their vaccination status. If they don't provide that to you, that's fine. They're just going to be deemed to be unvaccinated because they haven't provided you proof of their vaccination status. And we're going to get to different ways that they can provide proof to you of their vaccination status. If they don't want to provide that information to you, that's their right, but they're going to be deemed unvaccinated, which means they're then at that point going to have to be tested every week and wear a mask at all times. And that's fine. They can do that. If you as the employer offer that option, and you don't, as the employer, do not have to offer that option, you can mandate the vaccine. But the way the OSHA has written these is that there is not going to be that HIPAA protection, if you will, in regards to that request of confirmation of vaccination status.
And all of these points that you're talking about are having to do with non-exempt employees. People who are exempt do not have to wear a mask and get the testing and so forth.
Oh, no, if they're exempt, yeah, just because they're exempt, that they're exempt from getting vaccinated, okay? And I say exempt, the ones that they fall into the reasonable accommodations or because of a sincerely held religious belief. That's one we're seeing the most of right now. Those individuals, just because they have a religious accommodation doesn't mean that they don't have to do anything. There has to be an accommodation, and that accommodation very well could be weekly testing and mask wearing at all times. That would be the accommodation. So they may not be vaccinated, but they're still going to have to follow the guidelines that Rachel's going to talk about in each employee's policy. So that employee who has a sincerely held religious belief that prevents them from becoming vaccinated or receiving the vaccine is now going to have to get tested every 7 days and provide documentation of the negative test, as well as wear a mask at all times. Failure to receive a negative test every 7 days, that employee is not going to be able to report to work, and that's going to be unpaid time off, or they could use their own paid time off if they wanted to. And that the expense of the test is going to be on their burden as the ETS, as we discussed already.
But the cost is to the employer for the time off for the person to be tested.
If you're going the route of being tested, so you have a vaccine mandate, and we're going to get to that in a second, but we can talk about it now. If I have a vaccine mandate, the time that the employee spends getting tested, or not getting the vaccine. So if they're getting vaccinated during work hours, the employer is going to be responsible to up to 4 hours of time off or pay to that employee for each dose. Okay, so and that's going to include the time of actually getting the shot, filling out documents, traveling to my doctor or wherever I'm getting my vaccination. The employer is going to be responsible for a reasonable paid time off for any side effects. But when it comes to the testing aspect, not the vaccination, but the testing, that is on the employee. The employee is responsible for all costs of testing, not vaccination. So if I was the employee and I've chosen not to get vaccinated, I have chosen instead to test every week, that cost will be on me. And that the hope is that's enough of incentive to some to get vaccinated.
Okay, well, we have a lot of questions that are having to do with the documentation, with how the legal, the recent legal things that will be affecting, and I know all of that is part of your upcoming presentation. Yes. So we have a lot of people eager to find out more. So go ahead.
Complete understanding. I know Rachel's going to talk about documentation in a second. So let me keep moving on to the next slide. And like I said, if we don't, I got a couple more minutes, and if we don't, whatever we don't cover, we have more questions, we certainly will talk about them. We can address them in the question and answer, because I understand there's going to be tons of questions. I get it, perfectly understandable. So proof of vaccination. So this is what you're going to request from that employer or from that employee, one of the above, if you are one of these bullet points, in order to provide proof that they have been vaccinated. And one's a record of vaccination from the employee's healthcare provider or pharmacy, or a copy of a medical record documenting the vaccination, or a COVID-19 vaccination record card, or a copy of the vaccination record from a public health, state, or trial immunization information system, or a copy of any other official documentation that contains the type of vaccine that was administered, the dates of the vaccination, and the name of the healthcare provider that administered the vaccination. So if I was the employee and there's a vaccine mandate, or even if there's a choice, if I decided to become vaccinated or have been vaccinated, I can provide you one of these 5 documents to you, or a copy of one of those 5 documents to you as the HR person or the individual that's receiving this information. And you will maintain that in a separate file from my personnel file, my medical records file, if you will, as proof of my vaccination status, that I'm fully vaccinated. You would then, on the roster that we talked about, also next to my name, you would check the box that says fully vaccinated. And then I have satisfied my requirement of providing proof of my vaccination status. Now, there's one other way of doing this, and this is what we talked about a little bit ago, that if I'm, as the employee, unable to produce any one of these above records, okay, I'm not sure how that could be, but if it is possible that I've lost all those cards that I got when I was vaccinated, my medical provider doesn't have any documentation of my vaccination status, or I can't get a hold of my doctor, or maybe I can't do it by the deadline. I have the ability, as the employer can request, and I can sign what we call a written confirmation or attestation that I was vaccinated, okay? And it must include the language that's in that first bullet point, or the only bullet point on this slide. It must specifically state that I declare that this statement about my vaccination status is true and accurate. I understand that knowingly providing false information regarding my vaccination status on this form may subject me to criminal penalties. So if all else fails, the employee can sign this attestation that says that I have been vaccinated, and that would then be maintained in my medical record portion of my personnel file. My name on the roster, I would be check marked as fully vaccinated. So for those who may not want to go and show me all their medical records, I guess, if you will, or the card, they can sign this. If they don't do any one of those things, then I'm presumed to be unvaccinated, and therefore I'm going to have to either, depending on what the employer chose, but if they give me the option, I'm going to start to get tested every week at my expense, as well as wearing a mask at all times, for the most part, at my expense. Let's see. My last slide, and then we'll have Rachel come up. Okay. So we talked about this real already, so I'll kind of cut through it pretty quickly. The ETS also requires that employees be provided a reasonable time off to receive each necessary vaccination dose to be fully vaccinated, okay? So this is, as it goes on, this is 4 hours of paid time that should be made available to each employee. This is not, if I'm the employee, this is not me being required to use paid time off or vacation pay or sick time. This is additional 4 hours per dose that the employee or the employer is providing me in order to get vaccinated. The rationale being is that OSHA doesn't want any financial obstacles or hurdles to prevent people to become vaccinated. So I will be paid for the time that I spend getting vaccinated, okay, up to 4 hours for each dose. In addition, the ETS requires what they say, and it should be quoted, additional reasonable paid time off to recover from the side effects that the employee may be experiencing, if any, following each dose. So I get paid by the employee or by the employer to get vaccinated for those up to 4 hours. If I unfortunately have a side effect as a result of my dose that prevents me from going to work, the employer can require me, this is the difference, can require me at that point to use my paid time off or my sick time, okay, if I have it available. However, if I, as the employee, do not have any time available, I've used up all my sick time, I had used up all my paid time off previously, or I haven't earned any yet, in that situation, the employer will be required to provide me a reasonable amount of paid time off to deal with my side effects of the vaccination. Again, the reason being costs or finances shouldn't be an obstacle to getting vaccinated. Now, when we say a reasonable time, what does that mean? Well, OSHA's guidelines have indicated that a reasonable time is approximately, and they've said if you give each person a cap of 2 days per dose for side effects, that would be appropriate. So if I do not have any paid time off or any sick time, the employer would be responsible to providing me up to 2 days of paid time off per dose for any side effects that I may suffer that prevents me from working. Okay. And I believe that is what the last bullet point says, that employers may require employees to use available paid sick leave already available under the employer's policy. So that's that the employer will only be required to provide those 2 extra days, or at least 2 extra days, only in those situations where the employee does not have any other available paid time or paid sick leave to use, and the employer is requiring them to use it first. All right, so I will stop there because I want to make sure that Rachel has the opportunity to go through the policies that you need to put in place, as well as the documentation that you need to have and how you get it. And then I'll be back for both of us to discuss and answer all your questions.
I'm going to throw this out here. Sorry, do you want to start fielding some questions?
You want to field questions real quick before she starts, or do you want to just start and then we'll field them all at the end? Lisa, what's your preference?
Well, just one quick question, or a couple of quick questions, because of, and I know Rachel's going to talk more about documentation, but from what you've said so far, one of the questions was, can people get home tests? And of course, then there would be no documentation, or I don't know what.
Excellent question. And the guidance that addresses that specifically when it comes to the testing. Can they do a home test? The short answer is yes, they can do a home test, but it needs to be observed by either if you're a telemedicine proctor who can observe the home test and the results, or someone at work, an HR person can observe the test and or the results. They just have to observe one or the other, preferably the results. It can't be simply, I'm at home, I get tested, I get the results, and then I call my HR person and say, hey, I got tested and I'm negative, I'm good, because there's a lot of ways that can be fraudulently done. So you in that situation, I would have to have that at least one of those ends has to be observed from someone at work or by a proctor through my healthcare provider that's doing telemedicine. So they can observe me doing the test and then fill out a medical record or a record that indicates what the test results were, that they observed it. And then that document would be given to the HR person to show that I tested negative. And you could do that every 7 days. All right, that's an excellent question though. Is that okay? Any more, Lisa, or let me turn it over to Rachel?
One other, someone just asked, so you can require they use vacation for side effects as we don't have sick or PTO?
Oh, so yeah,
Go ahead.
So what I was going to say on that point is, so for employers who distinguish between different types of leave, they may require the employers to use sick leave. For those employers who don't distinguish between types of leave, whether it's generally just a paid time off bucket, the employer may require them to use a PTO for their side effects of the vaccination. And that's been, my theory on that is that OSHA is really trying to hit at those areas where there is mandatory paid sick leave. That's not Indiana, obviously, but that's where that's coming from. That's my opinion on that part. So,
and just one other quick question. Just, I know in talking to Joe previously, we are not talking about boosters. That is not part of any of the federal mandates.
No. So OSHA ETS is very specifically for primary vaccination, not boosters. So, and this will apply to all employees that exist and new employees. And so for new employees that employers bring on after implementation, they basically, the guidance indicates that the employer should require the new employee to become vaccinated if they do a mandatory vaccination policy as soon as practically possible. That's the language that they've been indicating. Okay.
Great. I know we have, lots more questions we can handle at the end. So because you're going to answer probably a lot of them. So welcome, Rachel.
Well, I will do my best to answer some of them. I don't know if I'll answer all of them. And of course, Joe has, I'll be honest, talked about a lot of this, what's in the second half of the presentation. So I will what I will do is try to be a little bit more efficient. I'm chuckling at Joe over there, so that we can field more questions at the end. Okay. So, I'm carrying on what Joe had started. What does the ETS require employers to do for its employees? The ETS also requires employers to implement a policy that requires employees to provide prompt notice to the employer that they've tested positive for COVID-19. So once that happens, the employer has to remove the employee from the workplace, basically to ensure that it doesn't spread to coworkers. Now, the return to work policy or the return to work timeframe, OSHA basically has said, follow the CDC guidelines. If all of us can remember, those were last updated in February earlier this year. So usually if an individual, and it also depends on vaccination status as well. So return to work can either be where the employee has at least 10 days since the first day of symptoms, 24 hours without fever and without fever reducing medication, and other symptoms are improving, or they were positive, they had a positive COVID test, but no symptoms, they can stop isolation after 10 days following the positive test, or if the employee has a returned to work recommendation from a licensed healthcare provider. Under those three circumstances, generally, the employee can be returned to work. Now, obviously, we have the subsection where if an employer decides not to do mandatory vaccination, but I'll say optional vaccination, the ETS requires an employee who has not been fully vaccinated to be tested for COVID every week. So if an employee hasn't been tested or hasn't been in the workplace for 7 days, they have to have a negative test before they can be returned to the workplace. I know Joe already hit on this, but employers are not required to provide paid time off for employees that have to be removed due to a positive COVID test or a diagnosis of COVID-19 by a licensed healthcare provider. Now, the ETS also requires employers to provide certain notice of information as it relates to the policies that they will be enforcing. And this is very much with respect to those who are not fully vaccinated that have to wear a mask indoors and while occupying a vehicle with one or more individuals if it is more of a service-oriented employer. So the notice or the information that an employer is required to provide is essentially a summary of the requirements of the ETS itself and what the employer has done to comply. They have to give all employees a copy of the CDC publication, Key Things to Know About COVID-19 Vaccinations. It also has to include, the notice has to include anti-discrimination and anti-retaliation language. In other words, we, the employer, cannot retaliate or discriminate against you for exercising your rights under the ETS and or vaccination policies that we have. Okay. And then also it has to include an explanation of the laws that provide for criminal penalties for an employee who knowingly supplies false statements or documentation with respect to vaccination status. I know that Joe referenced previously an attestation. If an employee either cannot or refuses to actually provide a medical record, they can sign an attestation saying that they are, vaccinated. If that's false, they can be penalized up to $10,000 as a fine under OSHA. So that's something that an employee needs to know if they are going to be providing inaccurate information. Here's an interesting part on this. The ETS was pretty clear that employers have to provide this required information in a language and at a literacy level that every employee understands, which I know sounds daunting. But for example, if an employer has a large Hispanic population, then all of this information, this notice has to be offered in English and in Spanish. And I recognize that that's going to be difficult if materials can be translated, that will help to meet that requirement. Now, I know I don't know if this is what the questions are being aimed at. Documentation. OSHA documentation for work-related injuries does not change, even if it is COVID-19. So employers are still required to keep record on OSHA forms like the 300, 300A, or 301, or any equivalent form if COVID-19 is work-related, okay? In addition to that, the ETS requires any employer to report a fatality due to work-related COVID within 8 hours of the employer learning about the fatality. And Joe and I were talking about this. Well, how does this happen? Well, this is how does the employer come to learn about that? And a family member is going to have to share that information. The ETS also requires an employer to report within 24 hours of a work-related COVID-19 diagnosis if an employee is admitted to the hospital. Again, that would probably require either the employee, in that case, the employee or the employee's family member, to then communicate with the employer about that information. I do think that this does have also workers' compensation implications, and I don't really necessarily want to go into that if people don't know that. But if it can be reasonably, if the contraction of COVID-19 can be reasonably tied to the workplace, I do also believe it would be covered by workers' compensation as well. So employers that elect the mandatory vaccination policy, they have to be, I've already said this, they require all current and new employees to be vaccinated. Joe's already gone over the exceptions or exemptions here. Those who have a medical contraindication, those who require or have requested an accommodation, whether that's a disability accommodation or a religious belief accommodation. And Joe also covered those employees who may not be required to get a vaccine due to what their work situation is. Those who work outside exclusively, those who report to a workplace with no other coworkers present, or those who work from home exclusively. That's because, as Joe explained, these individuals are not in grave danger. They're not exposed to potentially infectious individuals at work. Now, this, however, I want to do a little carve out to a carve out, of course. Employees who switch back and forth from teleworking to working in an office setting, and if they're working with coworkers, they have to comply with whatever policy the employer decides to move forward with. And in this case, if it's a mandatory vaccination, they either have to be vaccinated. Okay. Now, this is the part that I know you employers don't want to hear. An employer can be fined for failing to comply with the ETS and in the amount of almost $14,000 per violation, which can add up. Now, what does that mean? I'll tell you, the ETS wasn't really clear on that. Per violation per employee? I mean, I don't know if that's what we want to, or is it per day? Or is it just for failing to not implement the policy by December 5th and not to comply by January 4th? Those are things that I've yet to, it's not very clear based on the guidance that we've received and even by the Federal Register, the public published rule. And I know we've all heard about this because a lot of states have challenged, I guess, the legality of OSHA's ETS and whether OSHA truly has the authority to do what it has done. So the Fifth Circuit Court of Appeals, which I think most of us believe in the legal world, is probably one of the most conservative federal circuits. That includes Texas, Louisiana, and I'm blanking on the third state right now, maybe Mississippi. I can't remember. My apologies. So Friday, November 5th, the day that the ETS was published, they already issued an order enjoining enforcement of the ETS. What does that mean in plain language? The order basically bars OSHA from taking steps to implement and or enforce its ETS. And the Fifth Circuit's order purports to cover the entire United States. Now, right or wrong, that's what they've done. Now, after that, so within 1 week, the courts basically made the parties do a very expedited briefing schedule. And just last Friday, they issued their second order, basically affirming what they said a week before that, saying, no, we are right. We're keeping this order in place. We're going to stop OSHA from doing what it's going to do. What does that mean for you as the employer? That is it's an uncertain future, because what I will tell you is that in response to the Fifth Circuit's decision, OSHA did respond. They said that they were going to suspend all activities related to the ETS for the time being. And they said, quote, while OSHA remains confident in its authority to protect workers in emergencies, OSHA has suspended activities related to the implementation and the enforcement of the ETS pending future developments in this litigation. All but one of our 11 federal circuits have already have on docket and court filing challenges to the OSHA ETS. Now, because in these situations, when a whole bunch of circuits have the same challenge, perhaps for some of the same reasons, perhaps for different reasons, what the federal courts will do is basically select one circuit to decide all of those cases. So, and we call it a multi-district litigation. So we have one order, one outcome for the same challenge, because they don't want to have conflicting outcomes. So it's scheduled this week for the courts to decide which of the 11 circuits get to decide the challenges to the OSHA ETS. Now, we here at Barrett have been still advising our clients to move forward as if OSHA ETS is going to go into effect. It is uncertain. I know we basically spent the past 45, 55 minutes talking about what you, the employers, have to do, and now it's kind of put on hold. But we would recommend that you move forward with the ETS, with implementing your policies as if it is legal and OSHA has the appropriate authority to do what it has done. And I am going to open up the floor now, and Joe and I will go ahead and field those questions. I know I see the counts going up.
I was going to say, yeah, I think this is like a record number of questions we've ever had on our webinars. So, we wanted the questions in the Q&A, some are in the chat. So I'm kind of going back and forth, and we did go over some of them. So if I'm repeating, pardon me, just let me know. But one, we kind of gone over who can kind of authorize, it has to be a healthcare worker, even for these home tests. But someone asked, on the employer side, if it has to be an employer or can a supervisor read the test? Are there any concerns on who reads it and signs off at the workplace?
No, I mean, from the way the guidance reads, you just have to have a witness that's with the employer, if you will. So that could be a supervisor, that could be a manager, could be HR person that says, I've observed it, I can sign whatever, or I can make a copy of the results so that we have it for our records. If the employee feels more comfortable giving it to the supervisor or the manager as opposed to the HR person, I don't think that's an issue. I just think the bigger obstacles is making sure that there is some sort of observation or some sort of documentation that's coming from the employer or from a medical provider, as opposed to just relying on the employee doing it at home on both ends of the exam.
Lisa, I see some of those questions up there, and I'm gonna knock out a couple of those really easily, okay? If that's okay with you. One of them is whether the Fifth Circuit's holding affects government contractors. It does not. The Fifth Circuit's decision was very clearly with respect to the OSHA ETS as to private employers. And I say that because the OSHA ETS made it very clear that it's not with respect to the healthcare workers regulations or the federal contractors regulations as well. Those are two separate categories. This is just private employers with 100 or more employees. How can we be sure that it's work related with respect to COVID contraction? So that really goes back to workers' compensation and what's required by that. And I'll tell you, the burden is low. It's basically whether it's reasonably connected to the workplace. If, for example, Joe tested positive for COVID-19 and then I get it a week later because we are standing, although I know we're close, but we don't normally stand this close to each other. It's more than likely that I would have contracted it from him because nobody else in my household has it. And I know that leaves it wide open.
The one thing the guides did say is that there was going to be a presumption that it was going to be at work, that they would have, like in this situation, that's how she got it, but that the employer would have the ability to demonstrate through their own policies and procedures that they have things in place to prevent close contact, whether that was mask wearing or whatnot, or social distancing policies, those types of things, or simply even though we worked together, we were never within 6 feet of each other for more than 15 minutes, right. Those types of things, or we were on different floors, and the OSHA will look into those things and make a determination. Okay, yeah, that's really not work related, but there will be a presumption that it is work related. There was a couple on here about, will Barrett provide a generic template for the written policy? We actually are going through and trying to put a template together. Although I don't think it's going to be generic, it will be somewhat tailored for each employer. But we are putting a policy together that if you just give us a call, we can tweak it and get you something to help out, at least get that first obstacle, get you over that first obstacle. So I'm trying to look at the other ones on the screen, and
Yeah.
Lisa, if you have something that's pressing that we haven't hit, but otherwise I'm looking at the ones on the.
Somebody asked if they can just require all employees to mask up regardless of vaccine status.
You absolutely can. That's in fact the guidelines indicate that one, as the employer, you can't say discriminate or retaliate or discourage vaccinations, nor can you discourage any employee from wearing masks. So you can actually have a mask mandate yourself anyway. That's never a problem. One question on there says, what kind of documentation should an employer require for someone who's claiming accommodation for sincerely held religious belief? There should be a questionnaire is what we've done, and we prepared them for other clients, where there's a list of maybe 5 or 6 questions that goes through asking them what is their sincerely held religious belief. Have they been vaccinated in the past? How long have they had this belief? When was the last vaccination they had? Some of those types of questions to get as much information as we can. And then, in fact, what I've been doing, and Rachel and Tony Seitz, is we've been reviewing a lot of these for clients and giving them the, yes, this is a
legitimate,
or it's not. And just to give you a heads up, the hurdle to show a sincerely held religious belief is very low. There's guidance that has been issued in the last couple of weeks that that demonstrates that. Not to mention that if you just go on the internet, unfortunately, there's many locations that'll tell you exactly what you can say and reference certain scripture verses that will show that would probably get you over that line, if you will, to show that you do have a sincerely held religious belief.
Now,
not being critical that it's not sincerely held, but it's a pretty low hurdle. Now,
that being said, piggybacking off of that, and that is a question: can an employer turn down an exemption for sincerely held religious belief? The answer is yes, they can. But given what Joe said, it's a pretty low hurdle. It's lower than requesting an accommodation for a disability. But I will tell you, in the forms that I've reviewed, these people are pretty adamant, and for the most part, those who really want that sincerely held religious belief, in the forms that I've reviewed for clients, they've met that threshold.
There was a question up there: is can the employer be held liable if they have a vaccine mandate and someone has a bad reaction to the vaccine? At most, that would be a workers' comp type issue, but you're not going to have any personal responsibility. One, there's an emergency temporary standard saying that you need to do this, for one. Two, it's a work-related incident, so that again, you're not going to be held personally liable. Could there be a workers' comp claim? Potentially, but again, those are questions that I don't know we have all the answers for those quite yet.
And I will say this: the vaccine manufacturers do provide a list of potential negative side effects, and that would be another avenue for an employee who is required to get a vaccine.
What about employees with natural immunity from a prior COVID? That's a very excellent question. They address it in the guidance. They said at this point in time, there's not enough scientific data or evidence to demonstrate that those folks who had COVID previously are not still in this realm of grave danger. Now that could change, they said, but as we sit here today, even if someone had COVID previously, they still are going to, one, count towards the 100, and two, be within the grave danger, so that they will have to be fall within compliance to your vaccine mandate. Now, the one other thing that they did say, though, is that if I do not get vaccinated and I'm doing the weekly testing and I get COVID.
Yes, I forgot. I was going to say that.
Yeah, I don't need to be tested for 90 days after I recover from COVID-19.
Because of the likelihood of a false positive, because it's no longer active infection after 10 days. It just reflects past infection. That was actually in my materials, and my apologies. I was going to say that.
Trying to hit more. If you pick,
there was a question, some questions relating to ambulatory service centers.
Surgical
Someone
centers.
wanted to clarify. Is it
that's on the healthcare one?
Yeah. If the employees who are employed by ambulatory surgery centers do not have a weekly testing option.
Yeah, now that's a good question. Now, there was back in June or July, I believe, there was a ETS for healthcare workers, and there were some employees that would be exempt from that based upon where they worked or the type of work they're doing. However, if they are exempt from the healthcare ETS, that means though that they would fall under this ETS if they work for someone who has over 100 employees. So they could still fall within these requirements and still be mandated to be vaccinated and or get weekly testing if they fall under, even if they don't fall under the healthcare one, they may fall under this one. So just because they don't fall under the healthcare one doesn't mean that they're exempt from this one. You have to look at both of them.
Can we legally tell our employees the percentage of employees vaccinated? I would probably say no. An employer's documentation of vaccination, while the ETS is very specific on what an employer needs to do to document, for example, keep a list, it's confidential. It's no different than an employer, like Joe said, obtaining information about an employee's health for leave of absence, whether it's FMLA or ADA. An employer's not sharing that with the employee's coworkers. This is the same type of information.
There was a question, I know, Christine, in regards to a reasonable accommodation for religious reasons or medical reasons for an employee to be tested. I'm not aware of any. I have not seen any. It doesn't mean that someone's not going to try to get cute and say that. They would still have to jump through the appropriate hoops. And I think that's going to be a much harder or higher hurdle. But this hypothetically say that they can somehow show that they can't get tested because of sincerely held religious belief or medical reason. Well, so you have to accommodate them, and that accommodation is meaning that they can't be at your place of work. They either would have to be able to work remotely, which may not be possible in the place of employment. And if they can't work remotely and they can't be at your place of employment, the other option would be they are on unpaid leave, so they can stay at home and not work but not be paid. Or they could potentially they could lose their job if there is no way to do that either. And there is no position that's open for them that would allow them to, be unvaccinated and untested because they're always going to be around people. So that's not going to be one that I think more people are going to want to do because they could end up losing their job or not being paid.
And that's the same analysis that you would go through for an employee that says, hey, I can't wear a mask because of an accommodation. And I will tell you, we've faced that during, since the beginnings when mask mandates went into effect. I can't wear a mask because I have asthma. I can't wear a mask because name the medical condition. Same analysis. They still have to provide the appropriate medical documentation to explain to the employer why their reasonable accommodation should not be to wear a mask. But again, well, then do we put them at home, work remote, unpaid leave of absence? That's what we would have to go through.
There was a question about, can you implement a mask mandate instead of verifying vaccination status? Yes, you can. As we were talking, the employer has the choice of having a vaccine mandate for all of its employees, other than some of the exceptions, or it can say, well, we don't want a mandate. We are going to encourage people to be vaccinated, and we still have to have all those policies, but we're only going to require weekly testing and a mask mandate. So in that situation, it would be more than just a mandate to wear a mask. It would be wearing a mask and being tested every 7 days for those who decided not to be vaccinated. You're still going to have to go through and ask all the questions about vaccination status and everything, but you're not going to go as far as requiring the vaccination for all your employees. But as we said several times, you can't discourage masks, and you can't discourage the vaccination. In fact, you have to encourage the vaccination and encourage masks in those relevant situations.
Do you need a copy of the proof of vaccination or a note that just saw the official documentation? We need the actual, like a copy of it, or the attestation, and that's kept in a confidential medical file. It's part of the ETS for documentation.
Can employers request employees to schedule their testing during off work hours? The regs or the guidance, and correct me if I'm wrong, it talks about how, as the employer, you don't have to pay the time. If I go get tested during non-work hours, or say I only work mornings and I go get tested in the afternoon, you don't have to pay me for that time. I didn't see anywhere that it said that the employer can say, Joe, you can go get tested off work, or during non-work hours. I did not see that. And I'm going to say at this point in time, I would not encourage employers to do that.
I agree with
I think
that.
it goes back to the idea that we don't want any financial or any other incentive or any other obstacles to people getting vaccinated. So
I would also piggyback that and saying, I think that kind of goes towards discouraging employees to get vaccinated or the whatever steps they need to take to comply with whatever policy the employer chooses to implement.
do we also have to track on the roster the booster shots? As of today, no.
No.
I mean, and realistically, the last time I checked, so don't hold me to this because things change so frequently, but the CDC really is only requiring or recommending booster shots to those, I think, is 60 or 65.
And healthcare workers.
Healthcare workers, those who have underlying health conditions.
So it's
those-
basically the first wave of primary vaccination last winter.
But, will it be expanded to others? It's very possible, very likely. I don't know. And maybe they will change that at some point so that the roster will have to show that. But as of today, or when this seemingly will take effect, that's not a requirement yet.
Sorry, we're trying to hit some questions now in the chat too,
Yeah,
just to make sure.
Someone wants to know they're a subsidiary of a nonprofit. We have our own 501c3. They file under, the 990 and their payroll is filed separately, but they're under 100. So they have like 30 people. So are they exempt from the mandate?
So we have been getting that question a lot. When you are a wholly owned subsidiary with ownership, are your HR or safety functions different? If the answer to that is yes, you are a separate corporate entity for purposes of OSHA ETS. That's my interpretation. That's how I have been doing that based on the guidance, based on reading the rule, based on reading all of the other summaries. If there is no common or shared decision-making on safety issues, two separate companies.
Good question. Lisa, is there
I
other
think so
questions?
many
We're kind of
other-
skimming through it.
Yes, so many others of the questions are asking you to kind of be, look into the future as to, extending this and so forth, which I know you can't do. So just
I will tell you, this is what I'll tell you about what I think is going to happen in the future. Okay. I know that OSHA went through some great and painstaking detail about why they chose 100 or more employees for this ETS. I do truly suspect that OSHA may be expanding it to all employers eventually, because the comment period is to those who aren't covered by this ETS, those who are smaller employers. And I do think that's where they're trying to go. Obviously, now we have the hurdles with the court, with the challenges through the court system, and I'm not necessarily going to comment on that, but I do think ultimately that's where their goal is. So they would be issuing possibly another ETS in the future for employers with 99 or 99 or less employees.
It says if those vaccinated don't have to wear a mask, how do we keep that confidential? Well, first of all, they don't have to, they can. The fact that they are wearing or not wearing a mask at this point in time could mean a whole heck of a lot of different things. So I don't think that's an issue that you need to be concerned about in regards to the confidentiality of that aspect of it. I think the bigger issue has always been if I have a reasonable accommodation for a disability or religious reasons, are those the only ones wearing a mask? And it sounds like then at that point, we're treating them differently, but that's not gonna be the case either, because if you have the option of wearing a mask and getting tested weekly, it could be a lot of different people that are wearing masks. It could be someone who is vaccinated who just didn't want to disclose that to anybody, even the attestation. So they're going to be required to wear a mask. The one about the unionized employees is something that you have to bargain the mandate. Go ahead.
No, what I was going to say is I remember it might not have been this guidance, but I know that I've read guidance about unionized employees and the CBA. I mean, I'll let you go first. I have my thoughts on that. The guidance initially said this does apply. So even unionized employees go into the count, and they should be complying. Now, because of the compliance period in this section, I don't know if there's enough time to bargain. I think they have to.
Yeah, I think it was mentioned in this guidance, and the responsibility in regards to unionized employees in the collective bargaining agreement. I think what you, at this point, I have the regs and I
I
just
know.
don't remember the specifics, other than I would say this. You sit down with your union rep and you say, hey, we all know what this vaccine mandate says and what we're required to do. I think when it comes to whether the decision between a mandate or the masking and the weekly testing could be something that you certainly discuss with them. But what I'll do is, if you don't mind, the person who asked that question, you either email me and we'll get you a more specific answer. Because I know it does address it, but I don't want to give you this thing. I think another question was in regards to vacation time, PTO time, sick time, and how does that impact the reimbursement, if you will. So, but please email me separately offline and I'll get you that answer.
Okay. Tammy Broadzeller. Hi, Tammy. How much should we not share with managers and teams regarding those who have been granted exemptions, especially when having a required in-person meeting and a few have to be remote as an accommodation? This is an interesting one. When you're on a supervisor level, I think it's no different than any other accommodation, and it's on a need to know basis. I don't know necessarily at this day and age, and I recognize you, Tammy, are requiring an in-person meeting, but I don't know that anybody really is paying attention to who attends things remotely anymore, and why or why not. You can call me later to discuss that in more detail. I don't know that it's necessary to do it in that circumstance. It would just be to conduct it.
Yeah, I guess I think maybe when it comes to what managers should know and how much information, I think it goes back to that need to know. Does the manager really have a need to know whether Joe Cohen has an exemption or not? If there is a need to know, then you let that person know. But if there isn't, it would be nice if I knew, but it's not that big of a deal. Then I think you err on the side of not letting that person know, or those individuals know what that accommodation is or what those accommodations are. You can always tell someone later if you need to, but once you've told them, it's already out of the bag, if you will. So I guess I would always err on the side of keeping that circle as small as possible.
Yep. Can we discipline an employee if they refuse to test weekly? So if an employer decides not to do the mandatory vaccination policy, but I call it the optional vaccination policy, if they're not going to be vaccinated, they have to test weekly. And if they're not going to comply with the policy, you can terminate them because they are failing to comply with the policy. It'd be no different than the employer that chooses a mandatory vaccination policy and the employee chooses not to get the vaccine and is not exempt for any other reason stated by the ETS. Terminate them for failure to comply with the policy. I know that sounds harsh. The ETS has said we can do that.
Great. Are there any other questions that you see?
We'll go back to that one. If an employee cannot or does not get the weekly required test, would the employer not allow them to work? Yeah, so if you don't want to terminate them, then the option is that they cannot come into work until they get the negative test. And one thing that we've talked about it before in other seminars and we've talked about in the guidance is that that employee should get on a weekly schedule. Maybe it's every Monday they get tested and then they get the results on Tuesday. So if they keep doing that same schedule, they're always going to have their test results every 7 days. And so everything should flow smoothly. If I'm late getting my test or I don't go on that Monday, I go Tuesday, well, then I'm running the risk if there will be a day that I'm not going to be allowed to come to work, and either it'll be unpaid or I can choose as the employee to use sick time or whatnot, but you cannot let that employee come back to work if it's been more than 7 days and they don't have a negative test back yet.
Okay.
Is that everything? Oh, wait, there's one more. What is the likelihood the employer will have to pay unemployment due to termination?
Well,
that's a great question. As you've talked to us before, and actually, Cindy, I may see you this afternoon. The unemployment hearings are usually a little bit in favor of the employee to try to get them some sort of unemployment funds. I think if we have the ETS that's either mandating the vaccine, or you have done the other option where it's the vaccine or getting
weekly
tested,
testing and masks.
and if someone knows what that policy is, which they all should know because you should be publishing that policy, and they refuse to get tested or they refuse to get vaccinated, then as a result, there's no accommodations and you let them go. I think the likelihood is I like to say less than 50%. I may have just jinxed it and they're all going to get granted. I think it would be, I think you'd have a very good argument that employee knew what the policy was violated the policy, and they knew if they violated the policy, the results could be termination. That's usually what you need to show in an unemployment hearing.
And I will piggyback off of Joe. I handle a lot of unemployment hearings, usually on the appeals level, because the initial determination goes one way or the other. What I will tell you is generally, as Joe said, these administrative law judges are almost always employee friendly. But I do think that because this is in compliance with OSHA, a federal agency, I find it hard to believe that a state agency would go against that.
All righty.
I know there's still some questions. If you have any that we did not answer, you can email either of us directly. Joe is hjc@barrettlaw.com. My email address is rks@barrettlaw.com. We also posted our slides to our website at barrettlaw.com/conference. We want to thank you all for participating and all the great questions that you guys sent in to us.
And we're going to be sending out, so that Barrett and McKnighty has graciously agreed to follow up, as they say, on any email. So for everyone who registered today, and we're going to send out the video to everyone who registered. So everyone be on the lookout for that. So if you would like to view previous Business Weekly webinars or submit a topic that you'd like us to cover, or find out how you can become a presenter, visit us at www.kpceventbuzz.com/webinars. And the webinars are free to Business Weekly subscribers. Non-subscribers will pay a small fee. So thank you again, Joe and Rachel. I hope you come back again. You know, like I said, this was like a record number of questions. There's a lot of people, they don't want to have to pay that $14,000. So, so thank you for a great presentation, and everyone have a great day. Thank you.